heart attacks.
A St. Louis doctor is using a state-of-the-art tool to help patients with coronary artery disease. In tonight's cover story, Linton Johnson reports the test procedure may change angioplasty surgery forever.
At St. Louis University Hospital,
don't hold your breath. Nice, easy breaths. You may feel some discomfort.
Groundbreaking technology in the OR. And the doctor behind it all,
Dr. Aguirre, you have a call on line 3224.
this man, cardiologist Dr. Frank Aguirre.
That's it.
Today, Dr. Aguirre and his team are going to unblock this patient's artery using what's called a radial stent. It looks like this.
This new stent is interesting because, first of all, it's made out of new material.
For years, doctors have been trying to unblock patients' arteries with older types of stents like the balloon stent. But because of the older designs, doctors have had a hard time getting the older stents into some arteries, especially if they're curvy and small. But the material in the radial stent makes those arteries reachable because the stent's smaller and more bendable.
Both of those characteristics of this stent may allow for its use in a broader patient population that normally doesn't receive stents now. This one, it's so simple, so straightforward.
Dr. Aguirre is holding a catheter. The stent goes on the end.
And the stent is usually contained on the catheter between the two markers.
Nice, easy breaths. You may feel some discomfort.
Then the catheter is inserted into the patient's midsection and then into the blocked artery.
Going into the artery now. After we cross the blockage, we pull back the sheath slowly, and the stent self-expands.
The ability of the radial stent to self-expand is something no other stent can do. The old balloon stents had to be inflated, and that took a long time, putting a patient at a higher risk while on the operating table.
So this is a much, much quicker and easier deployment, no question.
Less work means better results for the patient.
Well, we would hope so. We'd hope so.
The Food and Drug Administration has not approved the radial stent. It is in the third phase of testing right now, which means 40 hospitals around the country are using this stent and putting it in patients. They've been doing that since December of 1996. Because it is so new, no one knows how effective it is. Doctors here believe it'll be every bit as effective as the old stents.
You need to touch it up with a balloon.
The radial stent is not a cure to coronary artery disease, but if it works,
All right, good. Breathe normally now. Ease off.
living with the disease
Don't hold your breath, please.
may be a whole lot easier. Linton Johnson, News Channel 5,
Is it feeling better now, sir?
cover story.
Patients who receive the radial stent at St. Louis University are a part of the testing program. When the procedure is performed, the patients don't know if they have the radial stent or an older model.
Well, we told Paul Goodloe that you ordered up more sunshine, and guess what?
Well, you know, Karen wanted it.